know you are very rich today and you may not even know it. I would like to talk to you today about how you can keep your wealth, which is your health. My aim is to inform you of things that erode those riches of yours, to create awareness on some conditions that can bankrupt the riches in a person. First, I would like to talk to you about blood pressure. What is blood pressure, or otherwise hypertension? High blood pressure is measured in milliliter of mercury. This is a condition in which the force of the blood against the arterial wall is too high. And a normal blood pressure is considered 120/80. Anything above 140/90 is considered borderline. But when it is a little bit above this, then it's considered hypertension, or you might be diagnosed as hypertensive. I would say if you check your blood pressure and it is above this, I would advise you keep a record of it. You can get a blood pressure cuff for measurement in a grocery store. This is over the counter. Or if you can't afford it, you can as well go to a grocery store. Most grocery stores have the machine by the pharmacy and measure it. I would advise you keep the date, the time, and the measurement, and take it to your doctor whenever you have the time to. The first number on the blood pressure is called the systolic. This is the amount of pressure exerted on the vessels where the heart is beating. And the diastolic blood pressure number is the lower number, which is the amount of pressure measured on the blood vessel between the heartbeat. This is when the heart is at rest. With blood pressure, if you discover it is elevated, I would advise you see your doctor. And if you're prescribed a blood pressure medication, I would say you take your blood pressure medication religiously. Always check your blood pressure before you take your blood pressure medication. Eat right. It is also controlled by diet. Avoid foods high in sodium, and exercise all the daily as well. All this helps to reduce blood pressure diagnosis. And the symptoms that you may or may not see in blood pressure are severe headache, dizziness, fatigue, confusion, vision problem, palpitation of the heart, chest pain, difficulty breathing, irregular heartbeat, to mention a few. If you have these symptoms, I advise you see your doctor immediately. And hypertension is known as a silent killer. You may or may not have any symptoms, but if you have symptoms, I advise you see your doctor for follow-up. And now I would like to talk about diabetes. Diabetes, this is a metabolic disease in which the body is unable to produce enough insulin. This leads to elevated levels of glucose in the body. Center for Disease Control puts it this way: diabetes is the condition in which the body does not properly process food for use as energy. The only reason why the body cannot produce is because the pancreas is not producing insulin to break down your food, which is in bulk sugar, to smaller sugar units. And if the body cannot break it down, you cannot make use of it as energy. So we have two types of diabetes. The first one is type 1 diabetes, and we have type 2 diabetes as well. Type 1 is a condition in which the body does not produce insulin. According to Medical News Today, type 1 accounts for 10% of all cases. And then type 2, this is the condition in which the body does not produce enough insulin. According to Medical News Today, type 2 accounts for about 90%. And also we have gestational diabetes. This is a situation whereby a pregnant woman is unable to produce insulin due to being pregnant. The symptoms of diabetes usually includes constant hunger, fatigue, thirst, dry mouth, itchy skin, peeing more often than normal, blurry vision. Diabetes, with diabetes, I would advise you see if you check your blood sugar. Often we have the meter called the glucometer, which you can also get at the pharmacy in almost pharmaceutical or grocery store. These are inexpensive. You can check your blood sugar, and if a normal blood sugar should be between 70 and 110, and if you are above 120, that's a borderline diabetes. And anything that is going above 130, I would say you keep the record of it, keep the date, time, and the measurement, and you can see your doctor. If you're going anything above 150, you definitely need to take oral or insulin, because these are the two treatment for diabetes. Either you take insulin by subcutaneous means, or you take oral. So see your doctor. Diabetes can be controlled by diet, exercise, and taking medication. Also, I would like to talk to you today about stress. According to the American Institute for Stress, stress as it is currently used was coined by Hansel in 1936. Hansel defines stress as the non-specific response of the body to any damage or change. When we feel stress, our body releases chemicals into the body, which turns to energy and strength. There can be good stress and bad stress. Good stress is when we are able to put the energy and strength into use. And bad stress is when the energy and strength cannot be put, you don't have any way of diverting it, which leads to you accumulating chemicals in the body. And causes of stress can be it can be environment, it can be survival, it can be fatigue. And I will advise with stress, there is no medication for it, but you can try and divert your energy into positive use. If you feel you're stressed out, if you have to go out and exercise, if you have to go out to release the energy, maybe go to somewhere where you can enjoy yourself, listen to music, sleep, whatever means you have that you can divert your energy into positive use, I say do that, because your health is wealth. And with all this said and done, I would say the three main things you need to do is always try and eat right, exercise all the time, and also make sure you do your annual checkup yearly as prescribed. Health is wealth, and I will advise you keep it that way. Thank you for coming.